This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health. Dr. Joel Lawley. All right, hello everybody. Let's go ahead and open up that Zoom room. And hello and welcome to Daily with Doc and Becca. My name is Becca Dukes, and it is officially Pharmacist Fridays. I am super excited as we are going to be bringing another episode that empowers, educates, elevates, and most importantly, helps you make the U-turns needed with information that you can put in your toolbox. Well, since it is Pharmacist Fridays, we have the one and only pharmacist, Ben Fuchs, who is internationally known. He had the Bright Side Ben show for a decade, for over a decade. Long time. And he has been teaching about the importance of nutrition and feeding your body from the inside out, as he also is a skin specialist. So folks, help me welcome to the screen. And before he says anything, because we are a resource for an amazing community, if somebody shared this program with you, make sure that you get back with them. They cared enough about you to share this program, so care enough about them to say thank you, and they will be your first point of contact if you have any questions in regards to today's show. Well, today's show is Ben Fuchs Live because your body deserves better answers, folks. So, Pharmacist Ben, welcome to Daily with Doc and Becca. How are you today?
Thank you so much. Oh my goodness, you didn't tell me my camera's off here. I didn't see that real quick. Okay.
It's all going to be great.
Well, maybe.
There, that might be better. No, that's worse.
Oh, well,
No. Move it to your left.
You just carry on. Yeah. I'll
Well, you're spotlighted, so everybody in the world sees you right now. But folks, this program is being sponsored by dailywithdoc.com, where we have good foods, bad foods list, articles that help empower you with more knowledge, and also a store with our number one choice when it comes to feeding your body intentionally the nutrients that your body was designed to thrive on. So, with that, thank you so much for joining us and providing this educational show.
Yes, ma'am.
This educational show.
Yes.
You know, I was going to do your favorite disclaimer, but...
No. Isn't it recorded? You already have it recorded. And I know you have to
Actually,
do it.
those,
I just give you a hard time because it always strikes me as kind of like shrinking us, marginalizing us, making us less important than we really are. You know,
yeah,
it's interesting because there are certain things that the medical model is very good at, surgical procedures and heroic medicine, as we say, dealing with trauma. But there really isn't anything in their wheelhouse for dealing with most of the things that most of the health challenges that we face. They just don't have the tools. And that's because all medicine can do is shut things down, suppress, inhibit, block, remove. Um, they can only turn things off, basically. Health challenges require for true healing to turn things on, not to turn things off. Turning things off is easy. You shut it down with poison. You basically just poison it, or you extract it, or you electrocute it, or you radiate it. Making things happen is a much taller order for the medical model, but it's not a taller order for God, nature, the divine force, the intelligence in the human body. But we've been so diminished, and we've come to believe that we're so incompetent and unable to address our own needs. And this is true throughout, whenever there's institutionalization, government and law and medicine. We become infantilized. We become dependent. We suffer from something called learned helplessness. We learn that we're helpless. We learn that we're impotent. How do we learn that? Because we're conditioned to believe it. We're programmed to believe it. But there's forces at play that are bigger than us, viral and parasitic and bacterial and cancer and all of these things that we shake in our boots and quake in our boots about because we believe we're not capable of doing it. The most important message that we have here is not about nutrition, and it's not about health. They're part of it, of course, but that's not the most important message. The most important message here is about empowerment, taking our power back from an institution that could care less about us as individuals. And this is the nature of institutions. It's always the institution versus the individual. Institution comes from the word, or the root of the word institution is stit, institution. What does stit mean? Static. It stays the same. Institutions stay the same. Institutions don't die. Institutions don't have heart attacks. Institutions don't get sick. Institutions don't have children. Institutions don't have families to care about. Institutions don't have the same needs and desires as human beings, as individuals. And so the needs of an institution are not the same as the needs of the individual. And if we depend on an institution to meet our needs as an individual, we're barking up the wrong tree. And we don't have, if we depend on the institution to take care of us as individuals, we don't have any right to complain. We're going to the institution. They're not coming to us. We're going to the institution. And so when they extract one of our organs or poison us with medication or do whatever they do, and they don't help us get better, that's on us. Everybody out there listening to this program right now, you have an option. And that option is to take care of your own business, and we will help you. And that's one of the beautiful things about longevity. Not that we help with nutrition, yes, we do. Not that we help with nutritional supplements, yes, that we do. Not that we help with education information. We help with empowerment. We help you get your power back. And if you depend on an institution, you're barking up the wrong tree. But if you depend on people like myself, Dr. Wallach, Rebecca, Marilyn, AJ, we can help you make a world of difference. I said, help you. You're going to do it yourself. You're going to do it, but we're going to help you. You're going to do the work, but we're going to help you. And that's why we're here every Friday and Monday nights.
So, Pharmacist Ben, I'm glad you brought up Monday night because we already had a question. Is there going to be Pharmacist Ben Bites on Monday?
On Monday night? Yeah.
Yeah.
Yeah, definitely on Monday night. Friday, we got to talk about next
Okay.
Friday. I'm not sure what we're doing next Friday, but we'll talk about that.
Okay. But back to your intro.
Yes.
You know, they control us with fear.
Yes. Well, what is fear? False evidence appearing real.
Yes.
What's the opposite of fear? There's only, according to psychiatrists or psychologists, there's only two emotions, fear being one. What's the other one?
Joy.
Close. Love.
Love.
And that's literal.
Okay.
That's literal because fear separates. Fear is us against them. Whenever you're afraid of something, you've created a separation. Love is the attractive force. Love is not some airy-fairy kind of emotion, new age feeling. Love is literally things coming together. Gravity is love. When two drops of water are on a windshield, you'll notice they always want to go together. Love reduces surface tension. So everything always wants to come together. Fear separates, love brings everything together. And yes, they want us in fear, but the opposite of fear, or the antidote to fear, or what's underneath fear, because fear is fake, what's real underneath fear is love. Love of the body, love of God, love of each other, love of yourself. And that's really the solution. And when we talk about nutritional supplementation, you know what we're talking about? Loving yourself. When we talk about eating good foods and not eating the 10 bad foods, what are we talking about? Loving yourself. When we talk about breathing correctly, when we talk about all the health strategies we talk about, what are we talking about? Loving yourself. Love is the attractive force that pulls things together. It makes things whole. The word health comes from the word whole. Health and whole come from the same place. Disease is fragmentation. Dis-ease is when we're separated out and we're fragmented. What does the medical model do? It fragments us. It focuses on the heart, and it focuses on the liver, and it focuses on the stomach and the spleen and the brain. And you have a skin problem, you go to the skin doctor. You got a reproductive problem, you go to the OBGYN. You got a heart problem, you go to the cardiologist. And they separate all of these things into individual components, which doesn't work. They fragment to us. Health is about pulling everything together and recognizing the whole. And the body's a whole. And that's why we talk about the great systems. Why do we talk about the blood? What does the blood do? It connects everything. It pulls everything together. And that's why all disease cannot help but involve the blood. In fact, the blood is the source of all chronic degenerative disease because that's the unifying force. And to correct it, you correct the blood. And when you correct the blood, you not only help the thyroid or the skin or the digestive system, whatever you're working on, you help everything. And that's the beauty of this model. When you go to the cardiologist, when you go to the cardiologist for a beta blocker, not only are you poisoning your body, but you're only focusing on one part of the system. When you use your healthy brain and heart pack, or ultimate niacin or ultimate EFAs, or whatever it is you're using for your heart, you're helping your liver, and you're helping your digestive system, and you're helping your skin, and you're helping your brain as you help your heart, because it's an entire system. And nutritional supplementation recognizes the body as such, as an entire system. The medical model doesn't do that. It recognizes each component, and it's not its fault, because the medical model was born in the 15th century or so, when we didn't really understand how systems worked. Systems theory, which is the idea of systems, how everything's all connected in a system, how you can't remove one part without affecting all the other parts, and how one part can't be focused on without working on all the other parts, we only started to understand how the systems work from a scientific perspective until in the 1940s. So literally 500 years or 400 years post the modern medical model was systems theory. So it's not necessarily their fault, but it's time to move on. Obviously, it doesn't work. Obviously, the medical model doesn't work. And again, I always say this, but I'll say again, I don't like to have to talk to people who aren't physicians, who aren't part of the medical model. I want a physician to come on the call. I want a representative of the medical model to come on the call so we can talk to them directly. I always feel like I'm talking behind their back, but nobody wants to participate. So I'm just going to say it. They cannot help us. If you have heart disease, they cannot help you save for some kind of surgical procedure that perhaps is necessary, but they can't restore the heart back to its healthy functioning. They can eliminate disease, or they can reduce the symptoms of disease, but they can't make us healthy. Doesn't matter. We can do it ourselves, and we're going to help you do it.
Well, and, eliminating or turning off poisoning, when you suppress the body's natural response to something, doesn't that just allow
Obviously
whatever's attacking the body to continue to attack without you knowing it?
Yes, and that's the classic example is hypertension. Most high blood pressure, doctors are freaked out about hypertension, high blood pressure, for good reason. And if you go to the doctor, they'll say there's no reason for it. It's just, they call it essential hypertension. We've talked about this before, but it bears repeating. Essential means it's just part of you. An essential tremor is a tremor that has no reason, supposedly. Obviously, everything has a reason, but supposedly has no reason. It's an essential tremor. Essential hypertension is hypertension that has no reason. Obviously, there's a reason, but their position is it has no reason. It's essential. 90, 95, 97% of hypertensive cases are essential hypertension. No reason. Obviously, there's a reason. The reason is the brain is turning up the pressure because oxygen and nutrients are not getting to the tissues, and the brain reads the tissues. So the brain says, okay, there's no oxygen coming to the spleen or the intestine or the heart or the brain or whatever. It turns the dial up on the pressure to get more blood. But what do we do when we go to the medical, interact with modern medicine? We take something that does the exact opposite of what the body's trying to do, which is drop the pressure. That's exactly the opposite of what the body's trying to do. I talked to a girl today, she's trying to get pregnant. She can't get pregnant. She's got a condition called PCOS. PCOS is we don't ovulate correctly, and it follows hormonal changes that are associated with, guess what? Blood sugar. So what do? She wants to get pregnant. What do? They crank her with a hormone, a synthetic hormone, a drug that forces her body to ovulate when her body doesn't want to ovulate. Her body is saying, I'm not making a baby here. I'm not ovulating, but she wants to have a baby. So they crank her with a drug that forces her to ovulate. And she texted me today. I'm in terrible abdominal pain. What do? I just had my shot yesterday. Now I'm in terrible abdominal pain. All right. So this is what happens when you override the body's intelligence. And this comes from not respecting the body's intelligence and looking at the human body as inherently flawed. And that's really how modern medicine looks at it. They look at it as inherently flawed. In a way, they're right because it does appear to be flawed, but it's not inherently flawed. Its flaws are the end result of poor lifestyle choices. And that's what we're here to help people understand. And the first thing to do is to believe it. Not to say, oh, Ben and Rebecca and AJ, they're all full of baloney, but to believe what we're saying is true. And I think it's a no-brainer. And that's why I try to make it as simple as I can. But willingness and belief are the first thing you have to have if you're going to proceed down this road. And in reality, this is really the only road that you want to proceed down if you want to be healthy. Because as I said, there's nothing in the modern medical model's magical bag of tricks that can restore a degenerative body back to health. And so I don't want to run out of time, Becca. So let's dive in here and start taking some questions.
Absolutely. So folks, if you are here live with us and you have a question, go ahead and raise your hand. We're going to take as many questions as we possibly can before the end of the hour. And the first question, Pharmacist Ben, I'm going to take myself off because I'm going to be sharing an image. And folks, if you have a light stomach, you may not like this, but you know what? We've got people that need help. So the first one here, Pharmacist Ben, is coming from Karen. She says, I have a question for today's show. I have been battling cysts on both of my eyes for quite a while. Okay. I used the Super KB, pretty hard and heavy.
She's using what? Say that again.
The Super KB. So that's the ultimate Super KB, standing for kidney bladder. Pretty hard and heavy. I
Super
currently
kidney
take
bladder. Is that a kit system?
It's a product within the longevity line for.
I hadn't heard of that. Is it new?
No, it's been around quite a while. It's got
Super
cranberry
KB.
extract
It's called
in it.
What is it?
Yeah, Super KB.
Okay, what is that?
And the K and the B are together.
What is? Do you know offhand?
It helps to support with kidney and bladder function.
Well, yeah, it's called kidney bladder, but what is it? But that's okay. I'll see.
It does have some cranberry in it. I don't have it up on the screen, but I can.
It's a cranberry thing. Why is she taking that for the sty in her eye? Does she say?
No, she was taking that pretty hard and heavy.
For kidney issue. For kidney problems.
Probably.
Okay, so KB, Super KB, I'm sorry to interrupt you, but Super KB is a bunch of herbs for the kidney, or for bladder, actually for bladder infections, not for the kidney, for urinary tract and bladder infections, correct?
So her coach is saying for cysts. So
for cysts on the
Jill,
kidney? Hang on, Rebecca.
Are those cysts in the kidneys or in the bladder or related to the eyes still?
No, it's not related to the eyes.
Super
KB is cranberry, bilberry, and horsetail such.
Yeah.
Hygiene. No, it's a bladder drug. Uva ursi. Those are all bladder herbs. So they're not for cysts, although she may have cysts on her kidneys. Yes, ma'am.
She is taking it simply for the eyes, for the cysts, because the people have said that it's good for cysts no matter where they are. Now you may not believe it, and that may not be the right protocol. It's
okay,
not,
but she's taking it, but that's why she's taking it.
It's not working. She needs something else.
Of course, it's not working because it's not going to help her cysts.
Okay, and she's been on the 90 for.
Okay, that's helpful. So here's the deal. Okay, do you know this person, by the way, Nancy?
This is Jill. Yes, I do.
I'm sorry, Jill. You know this person. Okay, good. So, styes on the eye.
It's not a sty. Did you see the picture?
I'm looking at it now. It looks like a
Oh,
sty.
you think it's a sty?
That's what it
Okay.
looks like. That's what it looks like from the picture. It looks like a sty. In any case, it's a growth. That's just semantics. You can call it a cyst if you want. You can call it whatever you want. It's a growth on the eye. Growths involve estrogen and insulin. Those are the two main reasons why tissue grows. So real quick, and it's hard, you got to get your mind around how the body is constructed from a building block point of view. Because we look at the skin, and I've been studying skin for 40 years, and sometimes I wonder, what do people think when they see the skin? Because we always call the skin an organ, but how does it seem like an organ? An organ is bloody and throbs, and it's gooey, and like the heart and the spleen and the brain, those are organs. And you kind of have a sense of what an organ is, but the skin doesn't really look like an organ. So you got to take a mental leap to understand the skin's organ-like nature. And when you understand the skin's organ-like nature, it makes more sense that it's made up of different components. As it turns out, the skin is made up of layers, and each layer has its own characteristic. And the bottom layers of the skin are where the livingness is. The top layers, there's no livingness. It's the bottom layers where there's livingness, aliveness. The top of the skin is not alive. And there's a very good reason for that, because it's got to be protective. The livingness is underneath. When you have a growth, what part of the body is being affected? The livingness or the non-livingness? Clearly, the livingness when you have a growth. Something's not moving correctly, not growing correctly. So this is a condition of cells that are not dividing correctly. Whenever cells don't divide correctly, whether it's cancer, which is a classic case, or whether it's styes, or whether it's boils, or whether it's psoriasis, or whether it's fibroids, or whatever it is, whenever you have cells that are producing lots of stuff because they're not dividing correctly, you have something interfering with the way cells divide. The classic two molecules that are involved in growths and interference with cell division are insulin and estrogen. Now, given the fact that 120 million Americans have blood sugar issues, and probably a lot more have insulin issues that we don't know about because those tend to go under the radar, the chances are pretty good this woman's dealing with an insulin issue. Now, we can just assume, and that's not a bad assumption really, and just start treating her that way, or we can start probing a little bit. So this woman, I'm only looking at her eyes, so I can't really tell, but I'm going to guess she's in her 50s or somewhere thereabouts, correct?
Yeah, upper 50s.
Okay, so upper 50s, say. It's almost impossible for somebody who's living the standard American lifestyle, who's not completely immersed in the world of nutrition, to not have some kind of dysglycemia or insulin issue. Next to impossible. So right away, you can pretty much assume that there's going to be a blood sugar or insulin issue, but you can ask questions. Does she have weight gain around the middle? That's another classic.
Not really. She's very thin. She's
okay.
too thin, but she has a lot of stress.
Hang on. Let me finish, please.
Sorry, Ben.
Okay. So does she have weight gain around the middle? Fine, she doesn't. Is she thin? Extra thin is another sign of hyperinsulinemia. So too much insulin can show up as weight gain or it can show up as incredible thinness. They're both signs of insulin disturbances. Does she have any vascular issues? Is she on any medication? Does she have cravings for sugar? Does she have hypoglycemia? You see what I'm saying? You want to start to probe a little bit to see what else happens. And there's another picture Rebecca's going to show me that is along the same lines. Things on the skin are fruits. That's the picture. Things on the skin are fruits. You have to go to the roots. And in a way, this is so simple that it's too simple. Because we find ourselves giving everybody the same answer, pretty much, with, there's little twists and turns, but basically it's the same answer. And that answer involves very little corrective measures. You don't have to take a lot of corrective measures to make a difference. So it sounds simplistic, but it's not. That's why I say belief is so important. Insulin is the most important multifunctional hormone in the body. It does so many different things. So by controlling insulin, you can control a lot of things upstream. Are you with me here, Jill?
Yes.
And so that's where you want to focus on. This is, if it happens, sometimes styes happen in the eye occasionally, and that's one thing. But if this woman looks like it's happened, can you put the picture up again, Rebecca?
Well, she's had it for months, and
Yeah,
the
this
last
looks like
time
it's
I
pretty,
saw it, they were a little swollen too.
yeah,
Like,
this looks pretty significant. And she's had it for months. Does she get new ones all the time?
you know what? That's a good question. I don't know, but I don't think
Okay.
so. I don't think they've gone away. But I remember seeing them. They had more of a boil look on them. So to me, they've improved since I saw them last. But she says they aren't.
If they're boils, then that means they're starting to get infected.
Yeah. Well,
Styes typically aren't infectious. So I'd be working on her blood sugar. Now I wouldn't, you go to a doctor if you want to just work on the stye. And we know how, how failed that can be. But sometimes cosmetically on the skin, a doctor can improve things cosmetically with lancing and with some kind of topical nutrient or topical antibiotic to accelerate healing. So she can go that route if she wants to address it cosmetically. But this is a shot across the bow, especially if she's extra thin, like you said.
she is thin, and Karen has a history of serious eye problems
If
before
this is not an eye problem, this is a skin
before
problem.
she started the 90.
This is not an eye problem, Jill. This is a skin
I
problem.
hear you. I hear what you're saying. There's blood sugar. That's actually surprising to me. But
Yeah,
like I
this
said,
is a skin issue. This is on the skin, and the skin is not unusual. The skin on the eye is very, very, very thin. It's the thinnest skin in the body. So if there's any disturbances in what's called differentiation, which is the fancy way of saying how cells divide as they're rising to the top, it's not unusual that it should happen on the eye. I'd be working on her blood sugar, first of all. I'd be getting her on the healthy blood sugar pack, and I'd be doing the anything that she could do to reduce her blood sugar from a dietary perspective, like the ketogenic diet, intermittent fasting, ultimate niacin, ultimate selenium. I'd be treating this as a blood sugar condition. That's the first thing. Now, typically when you have a blood sugar condition, if you want to do something else, typically when you have blood sugar problems, or even if you don't, but and you're symptomatic, you also have some issues with gallbladder, bile, intestine. Do you guys understand? Jill, I'll use you as a sounding board because I can't see anybody here. But do you understand that bile and the gallbladder play a major unappreciated role in blood sugar control?
yeah, definitely.
Yes, good, because doctors don't recognize that. Most people don't recognize that. So that's another place to work. These are all wonderful places that you can work. Healthy blood sugar pack, and if she has digestive issues, work there.
She does. I think that might be.
Okay, I was going to say to you, interviewing patients about other symptoms is often helpful. Although sometimes patients don't really recognize things as problems. So that's not a foolproof strategy, but it can be helpful. It's like if she were to tell you, oh yeah, I bloat or I have gas, or I can't eat certain foods, things like that, or I have a gallbladder removed, that kind of stuff, that can be helpful too. This is a blood sugar issue. Treat it as a blood sugar issue, I should say. And then I would be working on digestive health too, if she's symptomatic there. Okay.
All right.
And by the way, the same thing for that other gal, Becca. Skin problems, like show that other picture there. Those little bumps. I'm sure that gal, is she in the call by any chance?
I don't think that she's on the call, but
I'm
her
sure-
coach Marilyn is.
Yes,
So
Marilyn. I'm sure she's completely nonplussed. Like, what the heck is going on, right? And I'm sure if she's going to go to a doctor, she's going to go to a dermatologist because it's on the skin, right?
It's just what you said. She has sugar issues. She like loves bread.
Well, this is almost a classic case of a sugar problem, of a blood sugar problem. And I can't see if there's pigmentation or if it's her hair, but a lot of times there'll be pigmentation issues as well. It looks like there might be some pigmentation problems, although I can't tell. Have you ever seen pigmentation that's fuzzy on the neck or under the arms? Have you ever seen that condition? It's black almost, very dark. Yeah, that's almost a classic sign of insulin problems. And this isn't exactly like that, but it reminds me of that. And that's what I'd be focusing on.
Is it same thing with mold? Is that a sugar
Mold?
issue too?
What do you mean
You
by
know, like
mold?
people say like you have black mold. They'll
No,
say
mold is mold. Mold's an infectious. That's an immune system condition. Although
okay.
there may be some blood sugar problems involved, but that's an immune problem.
Okay.
And mold and fungal infections are incredibly difficult to treat because mold, they don't want to die, and fungus, they do everything not to die. So it's almost impossible to kill, and you got to use super, super, super heavy duty drugs.
all right, let's
Okay.
go on to the next question as we have 5 hands up right now.
5 hands.
And Nancy, what question do you have for Pharmacist Ben today? Plus, I have some questions that came in through the chat that do not have hands up. So Nancy, real quick, what
Okay.
question do you have today?
So I have Dr. Conaway's 20-day protocol for gut health. I just wanted to know if I should do the 2 or 3 day fast before I start that
You can
protocol.
fast. If you can, I can't, you don't necessarily have to, and that's more of a Dr. Conaway question because I'm not exactly sure what the program is, but fasting is awesome. If you can fast for 3 days, that'd be great. 2, great. 1 is even good.
And then when I
Eating.
go back to eating, is there a certain thing I should introduce each time to?
If you want to diagnose a specific food that you're having a problem with, yeah, you want to eat just one food. So say you want to check on beans, you suspect you may have a problem with beans. After your fast, just do beans for a day or for a meal. Just do beans. Say you have a problem with dairy or you suspect a problem with dairy, just do dairy or eggs, same way. You know what I'm saying? So after you fast, pick one food that you suspect is a problem and don't put a bunch of spices on it or a bunch of butter or something that'll interfere with your results. And just eat that food to see what happens. And that's a good
Okay,
way.
and if I don't suspect anything, if I don't suspect
If you don't
anything,
suspect anything, you have no, but you have symptoms, digestive symptoms?
no, well, other than being fat.
No, that's not a digestive symptom. I mean, like bloating or gas or constipation or loose stools or.
Loose, I do have,
That's all,
well,
then
I don't know.
that's an indicator.
I'm sure I have something wrong, but I don't
Yeah,
know.
loose stools are caused by a lot of things, but one of the things that causes loose stools is your body trying to eliminate something. And that's why that's the most common side effects associated with drugs, with prescription drugs, is loose stools. That's because your body's trying to eliminate stuff. Another reason why people have loose stools is because they have an issue with their gallbladder, or they had their gallbladder removed. That can also cause issues with loose stools. Irritants can cause toxic substances that irritate the intestine can cause loose stools. So malabsorption of minerals and nutrients can cause loose stools. So there's different things that can cause loose stools. But that's a sign. If that does happen, that could indicate that you're not absorbing nutrients, and that's something you want to check on. So I would look for foods that are associated with loose stools for sure. You can also
2 days on the new food, you say, or 1 day?
say again.
2 days or 1 day on the new food?
One
When
day.
I started,
Yeah, 1 day should be fine.
okay,
1 day should be fine. Thank you.
that'd be great. I'll let you know
Thank you.
later.
Thank you.
Thank you.
All
Okay.
right. Thank you so much, Nancy. And let's go right over to AJ.
Pharmacist Ben, how are you today?
Hello, AJ.
Fantastic to see you again. I have a woman who contacted me just before the show started and mentioned that she had a stroke. She's in the hospital, can't access her nutrients, and wondering what she might be able to use in the place of.
Oh, nutrients, soups, chicken soup, vegetable juice. I don't know. I don't know if they give in the hospital. Can she smuggle stuff in, or is she just dependent on hospital food? What
She's expecting to be out on Tuesday and then start on her regimen.
healthy? Yeah, healthy brain and heart pack as soon as healthy brain and heart pack as soon as possible. And then like certain foods like chicken soup, homemade chicken soup, aloe vera, vegetable juices, as much concentrated nutrition as she can get into her system. And that's why soups and juices, they give you concentrated nutrients that your body doesn't have to work to absorb.
Why were you thinking aloe vera?
Aloe vera for the heart, aloe vera for the blood can be, there's blood thinners in all. There's natural blood thinners in aloe vera.
Mm-hmm.
All fucoid Z too.
Mm-hmm. And then what about nerve wise reparative? Should you do any B vitamins or no?
Yeah, that's the healthy start pack. What's her symptoms? What does she have?
She just mentioned she had a stroke. I mean, she literally called right as we were starting.
All the healthy brain and heart pack stuff. I'd like to talk to her, but yes, anything she can do for neurology will help. And that's where the healthy brain and heart pack come in. The BTT has all the B vitamins in it. If she wants to do extra B vitamins, she can do something like the Ultimate Daily with extra B vitamins. But vitamin B1 is probably the most. I don't want to isolate that because they're all important. But B1 is especially important for neurology.
Okay, I'll see you Monday. There's plenty of people with questions here. I guess Becca's going to ask the ones in the chat.
Okay. Well,
Thank you, sir.
let's go for it.
All right, thank you so much, AJ. And we have one question here. So this is interesting, Pharmacist Ben. It just, maybe you can shed some light on it. So Miriam is writing, a month ago, someone she knows had surgery to remove 5 feet of dead and dying small intestines.
Oh my God.
Had very clear margins. The surgeon said there was no way, no explanation or why the bowel died, apparently over a period of a few hours. Essential bowel death. What might be caused? What might have caused?
Well, she had to be symptomatic.
die?
Things don't just happen like that. She had to be symptomatic. So what I can't tell you what caused it, but I would want to know what her symptoms, what other symptoms she had. Is she on the call?
Miriam is, the individual is
Yeah,
not.
I'd want to know what others, what happened along the lines. Bowel necrosis or essential bowel death, that's not like a medical term necessarily. It does, I shouldn't say it's not a medical term. It's not an explanatory term. The bowel, it's just died. There could be a lack of blood flow. It could be some kind of obstruction. But usually there'd be symptoms. It doesn't just happen. So I want to ask her what else was going on, and not necessarily just to find out for curiosity's sake, but so you can solve the problem, so it doesn't progress. If she has some kind of blockage going on, or what they call ischemia, which is disruption in the chemistry of the intestine, intestinal ischemia, you want to know that so you can make corrections so the problem doesn't get worse. So I'd want to talk to her, and I'd want to ask her about other symptoms. It's probably the best thing to do. Infection.
Miriam, do you have additional information?
Yes, this person just woke up at 7 o'clock in the morning with intense abdominal pain.
Yeah.
And after hours of no relief, he went to the emergency room and they diagnosed that part of it had died, or that they thought he had a twisted bowel, but when they went in there, they saw that part of it was dying and dead, and the margins were very, very clear, and there was no explanation. I mean, the normal explanations are twisted bowel or blood clot or scar tissue or a tumor. None of that.
Clots or anything like that?
Nope.
What was his history previous to this? That'll give you clues, because he wasn't perfectly healthy, and then this happened. Something must have been other things going on, right?
Well, he has other health problems.
That's how you assess these things. Remember my thing about Bob Ross? You ever hear me talk about Bob Ross in the paintings?
No.
Not.
So Bob, you have, Rebecca, right? So Bob Ross was a painter. He used to be on TV. He used to show you how easy it was to paint. And he was always really amazing how he would do this, because he'd put a little line in the middle of the painting, and it would just look like a line. And then he put another line and say, okay, there's 2 lines. But then he put a third line, and all of a sudden you could see a river. And then a 4th line, there'd be trees, and a 5th line, there'd be horizon, and a 6th line, there'd be birds. And it was just these little lines he was putting on the canvas. You know what I'm saying? And as he was putting lines in the canvas, a picture would emerge. And that's how you do this health thing. You get symptoms so a picture can emerge. If you just have one symptom, that doesn't tell you anything. Sty in the eye. Okay, that doesn't tell me anything. I need to have other symptoms so I can get a picture. Of intestinal necrosis or bowel death, that doesn't tell me anything. I need to have multiple points, sample points, data points, so a picture can emerge. And that's why I ask you what other health challenges he has, because once I get a picture of what's going on in his system, now we can start to address causes. If you just say, oh, it just happened, there's nothing we can do, you don't know what's going to happen tomorrow. You follow? Our mission here is to keep this problem from getting worse, or from additional issues arising. And without knowing what's causing these problems, we can't do anything. That's not the doctor's job.
Mm-hmm.
Their job is to take care of that necrosis, get it out of there. That's incumbent upon him with our help. So I would be asking him about other health challenges that he's dealing with. That would be the most important thing. Not to make him wrong, make him bad, pick on him, just so we can figure out what's going on in the system, Bob Ross style, so we can correct the problem.
All right.
Okay.
Thank you so much for bringing that question, Miriam. Let's go up to John. John, go ahead and unmute yourself. And what question do you have for Pharmacist Ben today?
Yes. Hi.
Hi.
My question is related to my spinal cord. I was recently diagnosed with degenerative disc disease.
Okay,
That's the L5 and S1, as
okay,
well as bulging disc in the same area. Let
okay,
me just preface that I had scoliosis as a child. As a
okay,
matter of fact, all my kids have scoliosis also.
okay,
So, what is it that I can do?
okay, gotcha. So scoliosis and degenerative disc disease, what I hear you say. Okay, now, the
Yes,
fact that
and
it's
bulging disc in the L5.
L5 is irrelevant. Doesn't matter. The fact
Okay.
that, what do you think the most important word in degenerative disc disease is? And there's
The
three
most
words.
Well, degenerative is
You
just,
got it, buddy. That's all you need to know is degenerative. You don't know about the disc. Doesn't matter. It's the disc. Because guaranteed there's other parts of you degenerating too. You're seeing
Mhm.
the disc. Degeneration of the connective tissue, which is the mass of the body, the connective muscle tissue is 90% of the body. Degeneration of the connective tissue doesn't just happen locally. It's a blood issue. It's all connected. So you're running a higher risk for vascular disease because there's connective tissue in the vascular, in the vessels. You're running a high risk for wrinkles because there's connective tissue in the face. You're on a high risk for osteoporosis and high risk for cancers because cancers depend on deteriorating connective tissue to metastasize. So we want to build your connective tissue. In order to build your connective tissue, we got to figure out why it's breaking down, why it's degenerating. Scoliosis is another example, by the way, of deteriorating connective tissue. So you were diagnosed with scoliosis, but it's really a degenerative condition at a young age, and your kids have it too. So how
Yeah.
old were you, by the way, when you got diagnosed with scoliosis?
I was 13 and I eventually had surgery where they placed a rod.
Scoliosis. Okay, so just for the listener, scoliosis is a curvature, is an abnormal curvature, sideways curvature of the spine. The spine will appear like a C or sometimes like an S. And there's nothing doctors can do for it because it's a degenerative condition. It's a sign that your connective tissue, specifically in the spine, is not forming correctly. It's breaking down. So again, that's the fruit. The root is upstream. Now, I don't know if you've been on a calls before, but we have something we call the triangle of disease. The triangle of disease are the 3 points that are always upstream of degenerative conditions. Degenerative conditions are always downstream, and that's why doctors can't address it. You got to go upstream to where they're caused from, and they're always caused by this triad. Now, the triad, if you haven't heard it before, I know we haven't talked about it for a little bit, but we used to talk about it all the time, is the digestive system and the blood sugar system and the adrenal glands, or the adrenal thyroid link. Can't really do much about the thyroid, but the adrenal glands you can. So 3 points. Number 1 is the digestive system in the intestine. If you have a condition called leaky gut, you probably heard of this, toxicity is going to enter into the bloodstream, and this is going to inflame the tissue. Inflammation of tissue, as we talked about earlier, is going to change the way cells grow. It's going to change the way the tissue develops, and it's going to lead to degenerative conditions. So you got to work on leaky gut if that's there. How do you know if you have leaky gut? Do you have digestive symptoms? Bloating, gas, diarrhea, constipation, the whole list that we talk about all the time. That's first. Secondly, when you have leaky gut, that means you have an intestinal problem. An intestinal problem means inflammation in the intestine. Inflammation in the intestine will make the cells spread apart, and that's where you get the leaky gut, but it will also compromise absorption of nutrients, which means if you have a condition of leaky gut that's so significant that now it's causing your tissue, your connective tissue, to degenerate, the chances are really good that you're not absorbing B vitamins, that you're not absorbing minerals, that you're not absorbing your fats, that you're not absorbing your electrolytes, that you're not absorbing vitamin C. So now you got this 1-2 punch of toxicity that's leading to inflammatory inflammation at the level of the connective tissues, causing the spine to degenerate. And on top of it now, you're starving. Do you see a problem here? And it's all because of the intestine. Now, additionally, and I'm guessing you're probably in your 40s, just by the sound of your voice, something like that, correct? 40s, 50s?
I'm 63.
Oh, 63. Good for you. So you sound good. So chances are pretty good that you're dysglycemic also, that you have blood sugar issues. That's the second point on the triangle of disease. So while there's nothing, and I'm going to repeat this, there is nothing that you could do for scoliosis directly. You can't take a scoliosis pill. You can't take calcium. You can't take scoliosis nutrition. You can't put a scoliosis cream on. There's nothing you can do for the scoliosis. Nothing. Do you get this, sir? This is really
Yes,
important.
sir.
Nothing. But you can go upstream and correct the problem where it began. Does that make sense? And that's what
Yes,
you
no
want to look at
problem.
now. And this is for your kids. It's especially important for your kids because if you don't, you're setting them up for a problem as well. So chances are pretty good that your kids are dysglycemic. That is have disturbances in blood sugar or insulin. And they're also dealing with this leaky gut problem and malabsorption of nutrients. So this would be important for all of you. Obviously, we want to help you, but your kids are even more important. I don't want to say they're more important than you, but they're younger.
No, I understand.
Okay, you understand what I'm saying. They're younger. So you want to nip it in the bud now. So do a food diary, look for problem foods. We're going to want to correct any intestinal problems. You're 63, you probably know that there's something going on. You have experience, constipation, diarrhea, gassy, bloaty. And if you haven't, notice it and then start to stabilize the blood sugar. In the meantime, because the connective tissue is global, that is the connective tissue in the face responds similarly to connective tissue in the bone and in the spine or anywhere else in the gut. By the way, leaky gut is a connective tissue issue too in many ways. You're going to strengthen the entire connective tissue system.
Okay.
And let me add one more thing. There's a very important chemical reaction between sugar and connective tissue, literally. So we talked about blood sugar and insulin chemically, metabolically. And so keeping your sugar down and stabilizing insulin is important chemically because these will accelerate or enhance inflammation. So you want to take care of those. But even literally mechanically, sugar burns the spinal tissue, the connective tissue. It's called glycation. You may have heard of this reaction. So working on blood sugar is also very important, especially for kids, because kids love sugar. So, I mean, we all love sugar, but it's easier for kids to go into this kind of immerse themselves in a sugary diet because that's just what kids do, and marketing is such that it appeals to kids. So you really want to focus on that with your kids. How old are your kids? The kids that have the scoliosis.
My oldest, he's 20. I have one 18. She just went to college, and one 16.
Yeah, you want to make sure they're taking care of themselves now. Otherwise, they're setting themselves up for a world of hurt. And as I said, I kind of glossed by it, but it's really important for you to recognize, sir. What is your name, sir, by the way?
John Jennings.
Yes, it's very important, John. You're at higher risk for a lot of other connective tissue deteriorating problems, including involving the heart and the blood vessels. So you want to really make sure that you're addressing your connective tissue concerns now, even though
my doctor also said I had high blood pressure.
Well, yeah,
I'm sorry. My doctor also said I had high blood pressure.
There you go. Now, have you been on a call before, John?
No, it's my first time.
Okay, good.
I mean,
okay, good. So I know for people on the call, they're probably sick of hearing this, but it's important, and there's also new people on the call. So I'm going to say this. I'm going to explain the whole mechanism. And John, I always like to explain mechanisms. I don't want to just tell you what to do. I want you to understand what's happening so you can figure out what to do with our help. Make sense?
Yes.
Okay. So the main way degeneration occurs in the body, and this scoliosis is a degenerative condition. The main way degeneration occurs in the body is through thick blood, sticky blood, viscous blood. Doctors call it hypercoagulable blood, blood that's not moving correctly. The blood is distributing oxygen, it's distributing nutrients, it's generating electrical charges, it's detoxifying. The blood is obviously extremely important. And the Bible says the life of the flesh is in the blood. The blood's everything. Once the blood becomes sticky, hypercoagulated, doesn't move as well, what does the brain do? The brain is responsible for controlling regulating the health of all of the organs. So when the brain reads the spleen, the intestine, the lungs, the heart, the brain itself, the skin, it reads all of these tissues for its health, determining its health status of the tissues. It will sense low oxygen. It says, oh my gosh, this is the brain talking. Their oxygen in the spleen is dropping. The oxygen in the heart is dropping. The oxygen in the skin is dropping. So you know what the brain does then? The brain will turn up the garden hose pressure. It turns up the pressure. You follow me on this? Make sense?
Yes, sir.
Okay, so high blood pressure is a sign that the blood's not moving correctly. And so the brain is turning up the pressure, to get more blood to the tissues. Anytime you have essential hypertension, you want to consider a blood problem. Now, why is this important for you specifically? Because scoliosis is a sign that the tissue is not getting nutriated and toxicity is building up. So it makes perfect sense that high blood pressure would be associated with scoliosis. What's more, it's the same problem. Leaky gut and blood sugar, which are the first 2 points on the triangle of disease. So you're not going to get out of this pickle overnight. You didn't get it, you're 65 or you're whatever you said, you're in your 60s. So you didn't get into this pickle overnight. You're not going to get out of it overnight, but you can start today.
Okay.
So I would be working on cleaning the blood. I call it cleaning the blood. And you clean the blood by stopping the stream of toxicity that gets into the blood through a leaky gut. And that means all the intestinal stuff, and longevity excels at intestinal products. I'll give you just a sampling. Fuchs Z, I-26, Ultimate Microbiome, Daily Digest, Nightly Essence, Ultimate Enzymes. I'm probably missing a couple here. Collagen peptides. These are all in the interests of control of strengthening strengthening the intestine to reduce leaky gut and reducing inflammation in the intestine so you can absorb nutrients. Then you want to start using liquid nutrition. Why liquid? Because you're going to be compromised a little in your absorption. Liquids are absorbed much more readily. So liquid nutrition, beyond Tangy Tangerine, of course, your Ultimate Classic, vegetable juices, soups. Chicken soup would be ideal for you because chicken soup is it has liquid connective tissue in it that will help support the building of your connective tissue. Aloe vera, as we mentioned earlier. What other liquids you could do? Noni juice, things that have molecules in them that are called polysaccharides. You may have heard of that term. But aloe vera and noni juice and chicken soup I call it bone soup with real chicken, not Campbell's chicken soup, but homemade.
What do I do? Because I haven't eaten chicken in over 30 years.
Okay, you're a vegetarian?
I do fish.
Then do fish soup.
Fish soup.
Yeah, you can do fish soup, but make sure you're getting bones and make sure you're getting the shells. If you do seafood, make sure you're getting shrimp shells. Shrimp shells have wonderful connective tissue building substances, particularly glucosamine. So you can use the shrimp shells in your seafood soup. Use shrimp shells and then, of course, filter out the shells, but put the shells in the water so that when you're boiling the water, the bone building or connective tissue building substances from the shrimp will come out in the water. Yeah, okay, that'll be new for me because I haven't done that type of seafood either in years. Well, enjoy. It's good. It's great. It's great longevity food. Okay.
Okay.
All right.
Yeah, I did start on the Tangy Tangerine and some.
That's awesome. That's awesome. You're not the guy that we talked to a couple days ago on Monday night, did we? Or a couple Monday nights?
No, this is my first time. I listened to Rebecca the last time with Dr. Joel Wallach.
Okay.
I ordered certain packages for the Healthy Bone and Joint Pack.
That's awesome.
And a few other things I'm looking at going ahead and getting to.
Well, welcome aboard, John. We are dedicated to your health. Call anytime. You can call me or Rebecca or Eddie. We're here to help you.
Certainly appreciate your help. Thank you so much.
Thank you. God bless you, my friend.
All right. God bless.
Okay.
Absolutely. Thank you, John. Again, yes, welcome to the family. And Ben, I'm so glad that you clarified, not Campbell's chicken noodle soup.
Not Campbell's soup, no.
Not Campbell's. Well, let's go to the next question. And Yasina, go ahead and unmute yourself.
Good morning. First time caller and first time here also. But my question is, I am 59 and I have been, when I turned 50, I had severe vertigo. And I have been going doctor to doctor, specialist to specialist. They've been ruling out. I don't have fibromyalgia, anything else. The only thing that my symptoms, I'm postmenopausal. Okay. So the reason of my call is to find out what can I do. I have anxiety,
Gotcha.
dry eyes, dry ears. I mean, everything that goes with
Everything.
menopause.
Oh, what's your name now?
And
What's your name?
Yesenia. Yesenia.
Yesenia. Yesenia, you sound like a disaster. Oh my God, what are we gonna do? I'm just kidding, Yesenia. This is very easy.
And I'm sorry, doctor, the only medication that I do take is high blood pressure medication, 50
Okay.
milligrams.
Which one?
And Losarna, I
Sorry.
believe
Okay,
it's
gotcha. Yeah.
Losarna. Yeah, that's the only one that I take.
Okay. Okay, so hang
My
on.
blood,
Oh, go ahead. I'm sorry. Go ahead.
my
You're
blood
good.
sugars, I'm at 100, fasted 102, 103. I control my meals. I cook at home. So the only thing is I feel very off. I feel I have headaches.
Yeah, we're gonna fix you up here, man. We're gonna fix you up. Okay. So all of the symptoms that you described, the vertigo and the headaches, what else? I forgot what else you mentioned here. You didn't mention high blood pressure, but I assume that that's a problem because you're on the losartan. All of these are secondary symptoms. Okay, we always use, and if you're first time on the call, I'll just, at the risk of boring people, repeating myself here, there's fruit and there's the root. Fruit is the rotten apple on the tree. Okay? The root is where the rotten apple comes from. If you got a rotten apple on the tree, can you fix it by working on the rotten apple? No. It's rotten. You can't do anything about the rotten apple. You're going to rotten apple doctors. And they're looking at the rotten apple and they can't figure out what the problem is because they're looking at the rotten apple and there's no problem there. That's the symptom. That's the sign. The problem is upstream. And that sounds like it could be really confusing because you say, oh my God, then now what do I do? All I know is what I can see. How am I going to go upstream? The good news is it's not that common because there's really only two major points upstream that you got to concern yourself with. And there's a mediating bridge between those 2 points and your symptom. Does that make sense so far? Yesenia? Do we have Yesenia?
She may have muted herself.
Okay, muted herself. Okay. Well, I would like to be able to talk to her, but okay, I'm just going to go ahead and say what I want to say.
yes, it does make sense.
Okay, I
I'm
want
sorry,
this
I
to make
couldn't
sense to
mute
you.
myself.
Okay, no worries. Keep yourself off mute because I want to talk. So I want everybody to understand this has to make sense. I do not want to tell you what to do by assertion. Just do this, do that. I want to tell you how this happens. And it's not complicated. We are all fully capable of understanding this. It's very simple. You have symptoms, fruit, if you will. In your case, vertigo, which is miserable for people who don't know. Do you ever throw up or is it just total dizziness?
I ended up in the emergency room 5 times throwing up and
Throwing up, yeah. Can you imagine for listeners, Becca, AJ, you ever have the spins? Can you imagine having the spins like they don't go away? Can you imagine?
I've had vertigo. It stinks.
It is beyond words, miserable, right? But you can't do anything about vertigo. You have, because that's the apple, you got to go back downstream. So the fact that you have high blood pressure tells me there's something going on in your blood, which, is a good assumption anyway. The only 2 places that you can work and need to work are your blood sugar system and your digestive system. Now, at this point, it may have gone into the third point on the triangle, which is the adrenal glands. You may have some adrenal issues. Did this problem get worse after menopause? Or did you know? Yeah, so
yes.
Probably has some adrenal issues there as well. The adrenal glands are responsible for controlling blood pressure. And when your blood pressure is not controlled properly, that can lead to a dizziness. Does the problem get worse when you bend down and stand up?
Yes.
Okay. So those are signs that there's some adrenal involved. So, which is not surprising because it's been going on for a while. But the first thing you always want to do in this triad, I call it the triangle of disease, in this triad of structures in the body, systems in the body, is the digestive system. And that involves doing a food diary, looking for problem foods, and then eliminating those foods and then doing digestive support. As I was telling John earlier, we got lots of great supplements for the digestive system. But first, you want to see what's going on with food specifically. If you're 59, then probably if you've had a food problem, you've probably had it for a while. So you're going to want to look for that. And then you're going to eliminate those foods and use the digestive supplements, digestive nutritional supplements. And then you want to work on the blood sugar system. That's the second point on the triangle of disease. And if you're like most people at the age of 59, you're going to have some issues with blood sugar. Now, you mentioned that your blood sugar is pretty stable. and pretty low. But that could be because your insulin is high. We don't know that. So insulin controls blood sugar, and your blood sugar can be normal secondary to or following elevated insulin. And elevated insulin itself is a problem, even if your blood sugar is normal. Doctors do not check for insulin, and it's very difficult, almost impossible, really, because insulin's connected to a lot of other things. So they'll check for blood sugar, and your blood sugar is fine, but you may be hyperinsulinemic, and I wouldn't be surprised if you were. How was your menopause, by the way?
Not good. The
And
menopause.
how were your menstrual cycles when you had periods?
No, I don't have any more menstrual
No,
cycles.
I know that, but when you had periods, when you had menstrual,
Oh, it was normal.
they were
Normal.
You had them regularly, and they weren't heavy.
Yeah, regularly, yes.
And they
I
weren't
never had
painful.
problem.
Why did they check you for fibromyalgia?
Because of the aches and the pains, they checked me for any like a disease and nothing, everything was ruled out.
Okay, well,
Nothing came back.
well, nothing came back in terms of estrogen, and that's what they check for. But you still likely have toxicity in the blood. Anytime you have aches and pains from head to toe, that implicates the blood. Why would aches and pains from head to toe implicate the blood, do you think? Yesenia?
Sorry, repeat that again. I
Why
was
would
reading the.
aches and pains from head to toe implicate the blood?
I'm not sure. I don't know.
Because the blood goes everywhere, right?
Okay.
The blood
Right.
goes from head to toe. So immediately, whenever, and this is for everybody listening to this program now or in the future, whenever you have a head to toe problem, you immediately know it's a blood issue. Now, in general, degenerative conditions are going to be blood issues, but this is obvious. Even your doctor can see this. When you have a head to toe condition, it's circulatory. How does your circulatory system get messed up? Well, if you're injecting things through your skin in the back alley, are you a crack addict? You're injecting a meth or heroin? No, I'm teasing you, see, I don't think you are. Other than that, how do things get into the bloodstream? Yesenia?
Through liquids, food.
Food. Do you see how you now become your own doctor in a common sense way, Yesenia? You see, I've got more information in 5 minutes from some stranger on the internet than you got in years from going to doctors. You have more control of your body right now because now you see what's happening. You've got a blood toxicity issue. At this point, it's probably stressing. You probably got some adrenal stress. The fact that you had a bad menopause tells me that there was definitely some kind of adrenal issues going on. And then the head to toe pain involves the blood. That means blood sugar, even though your blood sugar is normal, could be insulin. And that means digestive distress. These are all areas that you can work from the comfort of your own home without going to any doctor who can't do anything anyway. And we'll help you do that. Whoever your upline is, do you have an upline? Do you have somebody you're working with?
No, this is my first time.
Oh, okay. How we getting all these first time people? That's great. So we're going to
That's
work with you if you like, Yesenia. I'd call AJ or Becca, and they're great themselves, but they can always plug into me too. Okay? This
Absolutely.
is all doable, Yesenia. This is all fixable.
Thank you.
And check your chat messages, Yesenia. I just put some information in the chat for you there. Pharmacist Ben, do you have a hard stop?
I got a hard stop and I'm late. So does that all make sense?
It's 3 minutes after. So we
That
do
all-
have 3 more questions.
We do them on Monday. Get them on Monday.
On Monday, what time?
We'll do Monday earlier. Let's do it at 9 o'clock, AJ, 9 Eastern.
9 Eastern. Perfect.
God bless you
All right.
all. And I guess I won't see you next week, or we'll talk about that. I might be around. No? You taking off?
Hey, if you're available,
I might be. Depends.
okay. Sounds
Okay.
good.
You the
If I-
man,
if I
Pharmacist
could
Ben.
get the
Thank you.
co-hosts.
God bless everybody.
Thank you,
You too.
Pharmacist Ben. Have a fantastic weekend. And thank you so much for giving us more information that empowers us as individuals to make better choices. And how important is it that we have healthy blood, folks? That we not rely on a pharmaceutical to control our blood pressure or our blood sugar. It's through nutrition. And that's what this program is all about, is helping you realize the importance of what you put in your mouth, as Dr. Judy Reynolds says, in that pie hole, and how the body itself responds to it. So folks, if you were listening to this program and it spoke to you and you've got more and more questions, get back with the person who shared this program with you. Or if there's no one to thank, we do have a call team standing by of certified holistic health coaches at 855-949-3377. Again, that's 855-949-3377. And if you're watching us on any of the social platforms, make sure that you're following us. Go to our website, sign up for our email list so that you get notifications when the program goes live and information about the programming and our newsletter. And for those of you who are here because somebody cared enough about you, don't forget to thank them and ask them questions that you may have to get more information. Folks, my name is Becca Dukes, as a certified holistic health coach and also a certified naturopathic practitioner. It is my honor, my mission to make sure that people get information that they can do and take control of their own health. I myself was under the control of a system that pushed me off to pain management. After they couldn't, I refused their surgeries because I saw what it did with my aunt and my mother. I didn't want to go down that road. And I am so thankful that I didn't. So consider the fact that you saw this program as your sign that you yourself, as an empowered individual, can do more for yourself and your health journey, and U-turns are allowed. Again, if you have questions or have not spoken with anybody about this program or any of the information shared on this program, you found us on your own, give us a call at 855-949-3377. Pharmacist Bin Bites on Monday with AJ. Make sure that you sign up for a newsletter so that you get more information about that as well. It is not a live Zoom, but we do live stream to YouTube and Rumble and where else, AJ? Facebook and X. So for those of you who are on any of those platforms, make sure that you're following us. And have a fantastic weekend. Oh, AJ, your hand is up. I'm sorry.
So we have a lot of new folks who had questions. Make sure to tell them where to send the questions, right?
Yep. If you have questions, you can send questions to questions@dailywithdoc.com. Again, that's questions, @ dailywithdoc.com. Anything else?
I just want to say something to our coaches and our everyday viewers, if you don't mind.
Go for it.
All right, folks, this is the holiday season beginning. And next week, a lot of you are going to be around family. You're going to be next to your uncle who's had an issue for 30 years. You're going to be next to your grandma. You're going to be next to your aunt and cousin. And they all need help. They don't know they need help. They don't know where to go to get that help. But you can help them. I can remember being at Thanksgiving, helping an uncle who never listened to me for anything, except for the fact he said, "You look good." He said, he said, "What are you doing? I want to know what you're doing." And I helped him. I'm telling you, folks, this is the time. This is the opportunity. So please make sure you take the bull by the horns and let folks know that you know how to help them, and do it. Talk to you later.
Absolutely. And folks, You know, I have these co-hosts for a reason. AJ helping me host when I'm not available, making sure I don't forget anything when I am. He also has helped get us out on all these different platforms that are reaching you today. So I want to do a shout out and thank you, AJ. I also want to thank Marilyn, as she is busy in the chat, which is only available here if you're live with us in the Zoom room. So thank you so much, Marilyn, as she's doing dictation and she's putting additional information for explanation and how that you can continue to empower yourself and put tools in your toolbox for today, tomorrow, for yourself, your family, your community. And folks, as we're doing that on the home front, we're working together around the world to create a healthier world. And the last individual on the screen is actually in South Africa joining us, as he also is a certified holistic health coach and helping people in his backyard. And thanks to the internet and phone apps the way they are, he's able to help people around the world as well. So folks, if you've ever thought of wanting to have your own health and wellness business or become a health coach, you can get more information about the health coaching program offered by the Institute of Holistic Health by going to coach.dailywithdoc.com. And, you know, if you've never tried the products, I am so thankful I am a product of a product, because these products were the only solution after decades of researching. And I also wish that there was a pill that had helped me with scoliosis. But now that my body is nutrified, I no longer deal with that pain that was experienced, or the pain all over the body, like that F word, that Yesenia was told she had or was checked for. So everybody, I'm going to stop babbling. Thank you so much for joining us here today. Again, my name is Becca Dukes, and as a certified holistic health coach, a certified naturopathic practitioner, and also the director of student services for the Institute of Holistic Health, and the producer and host of this show, you are part of my mission. Let's make it a successful one by getting the 90 in you as well. Until next time, bye for now. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options.